Hello everyone, welcome once again to the channel. This is TWTV and this is your Wellness Way. My name is Dr. Budi. So today we'll be discussing breast cancers. Okay, but before we talk about breast cancers, let's understand what cancers are. So what is a cancer? A cancer is defined as a group of disease that involve abnormal cell growth, and these abnormal cell growth can spread through other organs that could be fatal. Okay, now normally cells divide, cells multiply, especially when our old cells die or when our old cells just get rid of. We need to replace these old cells with new cells. So the gene undergoes cell division and cell growth processes that could replace these old cells. When they replace these old cells, they are asked to stop or their function is stopped. However, in cancer cells, when these cells begin to divide, multiply, overgrowth, they do not respond to certain responses or certain regulatory mechanisms. They do not respond to it, so they keep on overproducing, just like that. And these cells that are overproducing are abnormal. These cells are non-functional. Okay, so there is this kind of increase in the number of size of the cell. So in breast cancer, the breast cells overproduce abnormal cells. Okay, and these abnormal cells form tumors, and these tumors could spread to other parts of the body. Okay, mostly the breast cancer cells start from the milk producing cells. So the cells that produce the breast milk is where the cancer starts, and then they would spread to, or they will affect, or they would invade other adjacent breast tissues, and then subsequently they will form tumors, and then they would spread across or through all parts of the body. Breast cancers is prevalent. Okay, so 1 in 8 of every woman has the chance of getting breast cancer, and in Ghana, over 5% of women or adult women live with breast cancers. Now, most people who are at risk or at higher risk of getting breast cancers are the risk. We have those that we can change and those that we cannot change. So those that we cannot change, for instance, risk factors is one, age. So it has to do with age. As you age, you have the risk of getting breast cancers. Now 2, women, of course, it's more prevalent in women than in men. So if you're a woman, of course, you stand a chance of getting breast cancers. Now also, exposure to certain medications could also predispose you to get breast cancers, and also genetic mutation. All right, like I said earlier on about how these cancers are formed, there are certain genes that are turned on in order to regulate the cell growth and cell division. However, if there is a mutation in the gene, then they would not respond to any regulatory mechanisms, and therefore they'll keep on producing, and that would end up in cancers. Now, the risk factors that you can change are 1. So those who are obese after menopause, those who are overweight, smoking, alcohol intake and all that, and those who do not partake in active exercises do stand higher risk of getting breast cancers. Now, what are the symptoms of breast cancers? Now, mostly breast cancers, those who live with or those who have breast cancers are asymptomatic, which means that they do not experience or express the symptoms. However, there are some visible symptoms of breast cancer. Some include 1, lump. Okay, so you would expect to have lump in your breast, but no, that's not all lump is cancerous. However, any small lump you see in your breast, please, you need medical Okay, and 2, the appearance, the shape, the size of your breast. Okay, so know your breast very well, so that if there is a slight abnormal change in your the size, the shape, and the appearance, then of course it should detect, or it should let you know, or should prompt you that you have breast cancers. Now also looking at the nipples, okay, the nipples. So you observe or you look out for abnormal fluids. It could be blood, it could be pus. Okay, so observe any abnormal changes in the fluids of the breast, the nipples. Then 2, the appearance too of the nipples, okay, and the area around the nipples should also be a symptom of breast cancers. And also in some instances you will find that out. You have pitting, you have redness, and you have some form of dimpling around the skin. So that should at least inform you that you will be suffering from breast cancer somewhere. Now, treatment. Before that, there are so many simple screening tests or screening tools that are available for checking for breast cancers. And so once in a while, or most ladies are advised to routinely screen for breast cancers. If it is detected early, it could be treated and cured. Yes, breast cancers are treatable and cured once it is detected early. However, if it is not, and it extends and spreads to other tissues, that is where the issue is. But there are certain treatment plans for breast cancers. Some include surgery, so surgical procedures. Now, they might want to remove the lump from the breast, or they might want to take off the entire breast tissue away. 2, there is radiation therapy. They will expose your breast to certain radiological therapies. They might also want to treat with hormones. So there's hormone therapy, there is chemotherapy, there are medications that are targeted to these cancerous cells, okay, and there is also the combination of all these, or 2 or 3 of these mechanisms, in order to treat cancers. Now, there are certain ways we can prevent cancers, okay. Some include 1, trying to quit smoking, reduce or limit alcohol intake, regularly exercising, okay, not being overweight, trying to reduce or trying to eat more fruits and vegetables, and eat less meat, okay. Then also try to gain weight and trying to lose weight, okay, and all that. Now, there are self examinations you can do in order to prevent or try to check yourself whilst you are home. Some include 1, you need to stand in the mirror, put your hand on your hip, stand and observe the size of the shape of the breast, the appearance of your breast. Now 2, you can also raise your hand in the mirror, then observe for any abnormal change. Now, once your hands are raised, you can start feeling for or looking out for a lump in your breast, okay? Then you can do that while standing or whilst you are lying down, okay? Now, these are some of the basic routine ways you can do in order to check whether there is a lump or any abnormal stuff around the breast areas. I'm so sorry guys, this video has to be long, but we have to do this because we are in the pink month, we're in the breast cancer awareness month, and so there is need to bring out this video. Thank you so much for listening. Subscribe, share, comment, and let's get interactive.